also dying for coffee.
Oh, hey Rachel, of course. I'm starving right now. Lucky Charms are my favorite, actually. I've always been a coffee person. I love my coffee extra sweet. You know, even though it's breakfast time, I think I still am gonna go grab a cupcake. It's always time for a treat.
I'll go with you. Maybe they have the oatmeal cookies I like.
Oh, awesome. They have my favorite. I love these for breakfast.
I love these raspberry bars when I want a treat. I have to go to the grocery store before class. Do you want to come with me?
You know, honestly, I think I'm gonna have to skip out. That breakfast made me so tired, and that cupcake made me so thirsty too. And I really have to pee right now. After eating breakfast, we can see that even though the food was very sugary, Rachel is feeling fine. This means that her pancreas is secreting enough insulin, and the insulin is taking the sugar out of her blood to store for later. Insulin needs to take the sugar out of her blood to prevent hyperglycemia, or high blood sugar levels. Once the insulin takes the sugar out of her blood, the sugar is stored in the liver for later. Rachel's blood sugar levels are reduced and are returned to homeostasis. On the other hand, Monica seems to be feeling lethargic and is experiencing polydipsia, which is excessive thirst, and polyuria, which is excessive peeing. These are symptoms of diabetes mellitus. Diabetes can be type 1, which is usually diagnosed at a young age, and the pancreas does not produce enough insulin to manage blood sugar levels. This is treated with insulin injections and moderating blood glucose levels. Diabetes can also show up later in life, which is type 2, and this can be when the body makes enough insulin but resists its action. Type 2 can usually be managed with lifestyle changes such as low sugar diets and exercise, but if not managed properly, symptoms can worsen and the patient may need insulin injections. Oh, good morning, Christina. How have you been? I've been loving my new moisturizer for my acne lately.
Hey Meredith, I have the same moisturizer and I've been breaking out like crazy. I've also started dermaplaning because the hair around my chin and mouth is so coarse. It's so embarrassing. I don't want it to look like I have a beard.
Huh, that's honestly really weird. You should maybe go see a dermatologist. How have your classes been going anyways?
They've been okay, but my day was kind of ruined yesterday. My period's been coming late pretty often, and I got it in the middle of class yesterday without knowing.
Oh, I'm sorry. That's kind of the worst. I hope you start to feel better.
Female sex hormones include estrogen and progesterone. But in this scene, Christina's symptoms are affected by male sex hormones, specifically androgens. The female body normally has small levels of male sex hormones, but when there are high levels, it can cause the manifestation of male characteristics, like facial hair and missed or late periods. When the body secretes abnormally high levels of androgens, this is called hyperandrogenism. Christina may want to get tested for PCOS, polycystic ovarian syndrome, which can be characterized by high levels of androgens. PCOS can lead to cysts on the ovaries, dark facial hair, painful and irregular periods, and acne. Obviously, this causes self-image and self-esteem issues for women because it can cause weight to fluctuate in unwanted male characteristics. But this can be treated with hormone therapy, such as anti-androgen medication, hormonal birth control, and surgical removal of ovarian cysts.
Hey Barbie.
Hey, Barbie. Do you want to walk on the treadmill with me?
Sure.
I actually just wanted to take a break because my hands were too sweaty to pick up the weights.
How you feeling, Barbie?
Barbie, I don't know if I feel too good right now on the treadmill.
Oh no, Barbie. How about we take a break?
Ugh, Barbie, lately when I've been working out, I keep getting a headache and my heart beats funny and my hands get really shaky. And my hands have been too sweaty to even lift up the weights. How can I be an influencer if I can't even work out?
Oh no, Barbie. Maybe you have a hormone imbalance. You should go see Dr. Barbie.
We can see that Gym Barbie spends a lot of time exercising, but she can only do so with the help of epinephrine. Epinephrine is a hormone that dilates bronchioles, increases heart rate, and increases blood flow to skeletal muscles, which are all very important during exercise to bring oxygen to the body. Influencer Barbie was seen struggling in the gym, with symptoms such as headaches, tremors, excess sweating, and heart palpitations. She couldn't walk very well on the treadmill and couldn't do her normal weightlifting routine. Epinephrine is a hormone secreted from the adrenal gland. Hypersecretion of epinephrine can occur from a pheochromocytoma, which is a tumor in the adrenal gland, and also causes symptoms that Influencer Barbie is experiencing. In all cases, the pheochromocytoma is located in the adrenal medulla, which is where epinephrine is secreted from. Symptoms can be triggered by stress and exercise as well, which is what we see in Influencer Barbie. If left untreated, pheochromocytomas can lead to cardiomyopathy, cerebral hemorrhaging, and pulmonary edema. Luckily, Influencer Barbie can seek treatment and get a surgery called an adrenalectomy, which removes the adrenal medulla with the tumor.
Oh, hey Kim, how is your studying going?
I don't know, Court. I've been so stressed lately for like 2 weeks. This anatomy exam is stressing me out so much, and I haven't been productive, and I can't even sleep at night.
Well, Kim, have you been trying to get any rest?
No, Court, I'm way too stressed. I went to the doctor last week. He told me I have high blood pressure and that I need to calm down. How can I calm down when I have anatomy to worry about?
Oh my gosh, Kim. You're crazy.
Cortisol is a hormone that is secreted by the adrenal cortex when the body is experiencing stress. Cortisol increases blood pressure by constricting blood vessels. Kim K has been stressed for over 2 weeks, which is a prolonged period of time. Her symptoms of high blood pressure, brain fog, insomnia, and excessive worry could indicate too much cortisol. During stress, the hypothalamus signals the anterior pituitary gland to secrete ACTH, adrenocorticotropic hormone, which then signals the adrenal cortex to release cortisol. This is an example of a hormonal stimuli, because one hormone, ACTH, is telling a gland to release another hormone, cortisol. The other two types of stimuli are humoral, which is when changes are detected in the blood or body fluids, such as blood glucose levels, and neural, which is when the hypothalamus directly signals a gland to release a hormone, such as when the uterus contracts, causing the release of oxytocin. Kim should make some lifestyle changes, such as seeing a therapist to develop coping mechanisms for stress.
Hey Olivia, it's a gorgeous day. Do you want to sit on the quad together?
Yeah, of course, Taylor. Let me just put my coat on. It's really cold out.
It's a cruel summer. You don't need a coat.
I'm freezing. My coat won't zip because I've gained so much weight and I feel so swollen too. It's like deja vu. I'm tired for the 3rd time today.
I know that all too well. Sounds like a hormone problem.
Good for you. You're happy and healthy, but not me.
The thyroid gland is an important endocrine gland that controls metabolism, body heat production, tissue growth, and blood pressure. As shown on the quad, Olivia is having problems with heat production, is feeling swollen and tired, and mentioned gaining weight. These symptoms indicate an underactive thyroid, which means that the thyroid is not secreting enough T3 and T4 hormones. The thyroid is also swollen because TSH, which is thyroid stimulating hormone, is building up in the thyroid. A common disease associated with the hyposecretion of T3 and T4 is Hashimoto's disease, which could be what Olivia is experiencing. On the other hand, hypersecretion of T3 and T4 can cause Graves' disease, which includes symptoms like tremors, body heat increase, irregular heartbeat, sweating, and an enlarged thyroid.
I had such a good workout today. I'm tired enough for bed by 9 p.m.
I know it's 9, but I still feel like I need to finish this coffee. I might be hooked. You know, for the Super Bowl, I was in that Dunkin' ad, but now I just think I have a coffee addiction.
Oh yeah, I saw your ad. Have you decided on retirement yet?
Honestly, no. I want to keep playing, but I also want to spend time with my family. And it's been keeping me up at night. And since I can't sleep, I just play on my phone and look up coffee orders now.
Wow, sounds like you've been having a lot of caffeine lately. There could be a lot of factors affecting your sleep. Maybe you should try to put your phone down and get some rest. I'm about to fall asleep myself. Good night, Tom.
Melatonin is a hormone that regulates the sleep-wake cycle and is secreted by the pineal gland in the brain. This hormone promotes deep sleep and helps the body get adequate rest. Gronk is an athlete with a good exercise routine that helps tire him before bed. Tom is also a great athlete, but has a lot of stressful decisions to make and certain bad habits that inhibit melatonin's job. Since Tom is on his phone so much before bed, the bright light tricks his body into thinking it's still daytime, which hinders melatonin secretion. Also, Tom is clearly having too much caffeine, which will stop melatonin from doing its job since it's a stimulant. Tom's lifestyle, his stressful retirement decision, and new job opportunities are stressors that affect hormone secretions like melatonin. Major life changes can affect hormone production and secretion, for example, losing a job, grieving a loved one, or moving to a new home. Even short-term issues like too much screen time or caffeine can affect melatonin secretion.